signal. It caused the body to start to degenerate right then and there. Now what happens then is the body tries to adapt. And so you'll get maybe a muscle spasm, you maybe, you know, you ever see people walk around like this? I see them all the time. I can't even look sometimes. I'm like, whoa, is something wrong with your neck? And they'll go, no. Why do you ask? Because they're used to it. It doesn't hurt them anymore. In the beginning, when they got the problem, it probably hurt. And then either the body put the muscles into spasm to try and protect the area, or they're avoiding moving it to the other side because it hurts over here. So biomechanically, the body will adapt, and it works so hard at adapting because you see people, you know, like this, walking around all the time. I myself, you know, was walking around, you know, like this. I didn't know it. How would I know it? You become used to it. But when I started first getting adjusted, the biggest thing that happened was the tumor went away. But the other things that started happening were amazing. I started getting more aware. That's just, it's sort of like things started coming back. Memories started coming back. I started integrating better. I was less crabby. I seemed to be more in control of my life. And my life sort of fell into place. I got more direction. I decided to go to chiropractic school. Dr. Mike and I, we flew back and forth for 4 years so that I could go to chiropractic school. He kept the practice here. I moved down to Atlanta with 2 of our children, had a 3rd one in the middle. We still kept flying and driving and coming back and forth, and 4 years later I was a chiropractor and came back and joined him in practice. And then we had Beth, who's working here and getting ready to go to chiropractic school. And 2 of our children are already chiropractors. So we believe in chiropractic so much that we are here and devoted to having this practice of light force chiropractic for the last 36 years. A subluxation, sub means under, lux means light. When you have a subluxation, it causes the body to degenerate, and it causes the area not to work properly. So suppose it was the C5C here. What would you expect to have happen if it was 5C?
Oh, laryngitis.
Yeah,
5C.
laryngitis. Yeah, laryngitis. That would be one common thing that could happen. Or you could get strep throat. Or you could be all the time, over and over again. So you know people with subluxations. I know people with subluxations all the time. They're walking around, they're wondering, they're taking all the medication. They're loaded with it. I have friends that are taking 13, 14 different medications. You know, they just start out with the one for maybe an infection. Then they get the one for the heart. Then they get the one for the diabetes. Then they get the one to solve the problems from the diabetes. And then eventually they don't even know what they're taking because they're so far gone. You know? So my job and the job of Dr. Mike is to help sick people get well and to help people with chiropractic. So I'm going to tell you a little bit about how it works. Okay, when you get a subluxation, the body is sub-under lux lit. The body is not sending up enough light from the brain or electrical signals to the body through the nervous system, that's the spinal cord, and out to the pairs of nerves that are coming out from between the vertebrae. When you get an interference or a subluxation, it causes a decrease in the nerve function. And when that happens, the nerve which is going to the organs and to the muscles decreases in its ability to function and doesn't send the signal back properly either. Not only is it blocked here, but it's blocked here. And over time, what do you think happens?
It shuts down.
That's right. It causes a decrease in starts to shut down. And really, just the pressure of a dime, if you put a dime on the nerve, it cuts that down about 60 to 70%. So just that light of a pressure will cause your nerve to malfire and to malfunction at that level. Now, if you have a decrease in health, it could be just like me. It went down, the rheostat goes down, the power goes down, but you don't even notice it unless it hurts. You wouldn't even notice it if you just kind of gradually lost power, because you think that's how it is. So if you put stress, though, on an already weak area, then you can start to have a symptom. And symptoms are never the cause of the health problem. The result. They're the result of a health problem. Having a symptom doesn't mean anything except your body's trying to call out to you to give you information about a health problem. And so people are almost always going here to treat the symptom. They're like, I have pain, I'm going to take something, I'm going to take a painkiller, okay? But they're starting down here. Chiropractic starts here at the cause. You cannot solve the cause of a problem if you're working with the result of the problem. It just causes you to keep going around in circles. And that's why we're having the healthcare issues that we're having out here. That's why it's so expensive. You keep treating the symptom over and over and over again and never get to the cause, and you never have a solution. So that's why we have a multi-trillion-dollar industry now called the drug industry that is just, not solving problems. By the time you get the problem to the point where you've gotten rid of the symptom, you've suppressed the body trying to heal itself so much that it turns into a worse problem. So the first thing is drugs, and the next thing is surgery. And then after that, disability or worse. So we like to start here with chiropractic care. And that's why we have several things that we will help you with yourself, because you're really responsible for your health. Your body, being a self-healing organism, needs, of course, good adjustment. Like gravity, you remove the interference, the body heals itself. Generally, the ligaments, which are holding the bones in place, take about 12 to 16 weeks to heal. So in the beginning, your intensive period of care is going to be, someplace in the 12 to 16 week range, unless you're under 10. And I'm glad you came tonight. I hope you learned something. It was nice to share chiropractic with you.
Thank you.
All right. Okay.